Welcome to the Flex Forward podcast, where grit meets growth. With your host, Nick Espinette, bringing you stories of resilience, reinvention, and the real climb to success.
All right, everyone, welcome to the Flex Forward podcast. Today, we're joined by Melissa Murphy. Melissa is an interventional spine and pain physician. I'm going to let her give you a little more detail about where she works and what she does and just a little bit about her. Melissa, thank you so much for joining us. Can't wait to get to hear a little more about you. Can you let our listeners know more about you and what it is that you do?
Yeah, thanks, Nick. Thanks for having me today. So I'm Dr. Melissa Murphy. I'm an interventional pain physician at North Texas Orthopedics. I have two office locations. One's at Grapevine, South Lake area. One's in North Fort Worth and Keller area. So I actually do all my training at Vanderbilt in Nashville for my residency in anesthesiology, and then I did a fellowship at Northwestern Chicago. So back home, this is where our family is. So just excited to be back and serve the community. And we've been here for 7 years and just love every minute of it. So part of my job is being a physician treating patients, but outside of that, I actually have a greater passion towards healthcare and platform leadership and education and advocacy. So I have a few different hats outside of my day-to-day job. I'm on the executive board for the American Society of Pain and Neuroscience, and I also serve as a chair for Women Neuromodulation for the North America Neuromodulation Society. I'm also chair of Innovation and Growth for our organization. We are we work on projects that will help the organization to grow and continue to innovate. So, that's my passion outside of being a physician is truly leadership, education, advocacy, and innovation.
Well, that's awesome because I mean, and you got a lot. I mean, very busy as a physician, but finding time to do those other things. But in leadership is so important, and helping others to grow in leadership. So that's very neat. So, in the world, as a physician, you probably to get through med school and your specialties, a lot of competition. What was something you felt like set you apart that's helped you to be able to achieve something that you feel has helped you achieve so much?
Yeah, that's a great question. So, a lot of us, the bigger question is why do we choose medicine, right? And sometimes as a high school student, as a college student, just to say that, hey, I want to become a doctor. And that sounds really cool. And for many people, that's the right thing to say. I want to be a doctor. But do we really love the specialty? Do we really love what we do? And being a physician is not easy, and it's lifelong learning. We're in school for a decade at least, and there are many, many years of training. And even after training, life is not easy,
Sure.
As a
changing,
practicing
right?
physician, right? And then there's a reimbursement landscape, navigating with insurance, and, the healthcare changes every year. There's so many things. It's hard to keep track of. And one thing is physician burnout. And me, part of my passion is to help other physicians develop platforms to avoid burnout and re-energize ourselves, that why we chose a specialty to begin with. But to answer your question, well, so we have to love what we do, right? So, and I think I'm very thankful. I truly love what I do. Every morning, I'm excited to get up and go to work, and I'm looking forward to the things I'm going to accomplish that day. And to me, work is not work. Work is passion. And I probably have the best specialty, I think. So this is what I do as interventional pain physician. Our main job is to help you with pain. So whether or not it's neck pain, lower back pain, and if you know that 1 out of every 3 Americans suffer from chronic pain, and it's so common, so debilitating. I think we all know someone in our family, friends who would say, my back hurts. I can't work today, and I can't go to the park today. I can't watch my grandkids because my back is hurting me. So, with what I do, I'm able to help them alleviate pain and give them this solution. Sometimes in a matter of a few minutes, right after the injection, they feel better right away. And in some moment, they have tears in their eyes. They give you a hug. They bring you a box of cookies, and it's a few minutes of my time. And next thing you know is they're in Europe and enjoying their vacation with their family. So to me, I think that's very, very fulfilling.
Well, and what a great it's got to be, because you're also helping somebody who, if they're in a lot of pain, they may stay in their recliner or their sofa and not even leave their house and see people. And so much of well-being and just longevity and quality of life is interacting with other people. So giving them the ability to go to Europe or just even to go to the coffee shop or something like
That's
that
right.
and see their friends, or play card, do something where they're getting out. It's got to be greatly satisfying to help people get out, and it helps the quality of life, not just the reduction of pain, but to being able to socialize with others, which they may not have been able to do if it's hard for them to walk.
That's right. Yeah, speaking of that, that's also part of my struggles every day is patient education. For many, many years, a lot of patients, especially the pain patients, they equate pain medication as a solution to their problem, right? So more pain medication. I just need to take 3 more pills today so I can get better. And I'm really passionate about changing that landscape and the mindset of, well, another pill doesn't mean better quality of life, right?
Hmm.
And my job as a physician isn't just giving you more pills. Let me help you get better in terms of your function, your quality of life, your wellness, and your well-being. And that's not an easy, quick educational session. Sometimes that takes multiple visits and
Sure.
hours of conversation to really change the mindset. And, this is really exciting about what I do in my field today compared to pain management 10 years ago is it's not about prescribing pain medications anymore. It's restoring function, quality of life. And I think of it as sometimes performance medicine. So we combine, lifestyle modification, physical
Hmm.
therapy, stress management, nutrition. And now I have many interventional tools. So I call myself interventional pain physician because I can do injections, nerve ablations, spinal cord stimulation, basivertebral nerve ablation. There's so many other very fancy advanced tools we have now that we probably didn't have a decade ago or
Sure.
20 years ago. So this is really what excites me the most. It's a technology that now I have so many things, the toolbox to offer to patients that now I can see the transformation from how they were before when they walk into the office to how they are now after we treat you multiple times with different therapy sessions that we have.
That's awesome. And what a blessing to your patients to get that. Because I think most people don't want to fall into the take a pill, because
That's right.
you start acclimating to it. And I think you need stronger pills, and there's side effects with your GI or just lethargy or, mind, just mental sharpness. If as you get more and more ratcheted up on the pain medicine, all these other, it doesn't just affect your pain area, it's getting the whole
Mhm.
body. So if you can get some of those more direct pinpointed treatments and that can get them function, I think just getting them out moving too has got to help
That's right.
some, just your the mentality of getting up moving and social and visiting, because I think we're all somewhat social creatures and want to get out and be with people some.
Yeah. So that's one reason, actually, really, the reason I want to join you today for this podcast is I'm excited about the opportunity to educate the public, right? Because I feel like we don't talk
Yeah.
about this enough, and it's something many people are embarrassed about. They don't want to tell people that I'm in pain. I'm a chronic pain patient. They hide. So during
Mhm.
family gatherings and holidays, they pretend to be a normal person. But then at the end of the day, if you see how they are suffering. They're in bed and they have to recover for days just because they
Yeah.
cooked one Thanksgiving lunch for everybody. So being able to just talk about this, bring awareness, hey, this is very common. 1 out of every 3 Americans are suffering from this chronic condition. And it's not something like flu and cough that will go away next week. That might linger for years to come. That can truly interfere with our quality of life and who we are in our wellness, our mental health. So this is such a big issue I think Americans are dealing with,
Yeah.
and being able to just to educate the public and patients is very helpful.
Definitely seek help for it, because anybody that, if you're having pain, you're not going to be the same person interacting with your family and friends just if you felt no pain. So it's,
Yeah.
getting that resolved and being able to interact is so important. So it sounds like you've had lots of success. So if someone's wanting to get better or learn how to improve at something, have you come across any tools or tricks or books or anything that you have listened to that have helped you in your path?
Yeah. So, some of that is a mindset, right? So, learning doesn't stop. It doesn't matter whether it's learning medicine or learning about life or learning about finances or interpersonal relationship. I truly believe learning is a lifelong process. And for me personally, I treat every opportunity as a learning opportunity, and I treat many people around me as mentors. And I believe we can learn something from everybody. And it could be our staff members, it could be our friends, it could be our patients, it could be our family. There's something other people have that I don't have. And what can I do to learn from you? So
Oh, awesome.
learning doesn't have to come from books and podcasts or classes, right? Or, learning can be just from that day-to-day interaction with people. So I think that's one thing, is the mindset of what can I learn today from this? What can I learn today from someone? What do they do that I don't have? Or how can I better myself? Just a little bit each day, and over time that can really add up. And now I know this. I listen to many of your episodes, and I just admire many people you interview and the things that they have overcome to get to where they are today. So I think the common theme that this is, we all have gone through something in the past to get to where we are today.
Sure.
It could be poverty, it could be, difficult life situation, could be interpersonal relationship, could be health and wellness. And some people struggle with health conditions. But you know what? All that is leading to us today as it's building our character and grit and a resilience. And many of us can't do what we do today if we didn't have a past in the past that lead to what we are. But then the question becomes, then what's the next step? What's after that, right? So just because we made it to this dream job that we have doesn't mean life will be rainbows and sunshines every day. And there's still things we struggle with every day. For example, I have an 8-year-old son and a 5-year-old daughter, right? And for me, I love being a mom. I love just being able to have kids, just to be their role model. And that's one way to look at this, is what can I do to help you, to influence you, to give you a better future. But many women, especially in business and in medicine, we struggle with this guilt, right? Do I spend time working? Do I spend time with my family? What if I miss my son's game one day? What if I miss the school event one day? How do you juggle through that? And during a lot of my talks with women, with physicians, I think one thing that we all agreed on is it's okay. It doesn't have to be balanced. It doesn't have to be perfect. We don't have to be at every single game or event. What matters more is our intention, right? So when we are present with our family, with our children, are we present? Are we setting a good role model for them? And sometimes my kids know that mommy's at work and she's speaking, she's treating patients. And to them, it probably means more than me sitting next to them to watch another episode of a TV show.
Sure.
So that's something that just we all struggle with from day to day. But by having this mindset of, well, what's the bigger purpose? How can I make it more influential for my kids in the future? I think it's more important.
That's awesome. And being involved, when you are there, having the quality time, and something you said, things happen to us throughout life. And I think it's Ed Milet said, he phrases it that things happen for us, not to us. And because you're going to get, you can be, how you react to a negative situation can set you down different paths. And, and some of us, the same exact thing could happen to somebody. And so one person could just curl up or run away, but the other could say, hey, I got to figure this out. This stinks. It's that something negative happened, but what can we do to learn from it and go forward? So that's something I've always tried to do, is how can we find a learning opportunity? And we've tried, I've got a 20, 18 and 14-year-old, and we look, you're going to have challenges in life, and how you react to them is what's important. Because you can really reduce your chances to have challenges and failures if you stay right in a very narrow, don't try anything, don't push yourself. But that we don't encourage it. I want you to get out there and try and celebrate failure. And now you can't accept it, but it's celebrate that you tried something new and maybe you didn't succeed at it, but learn.
Yeah. No, people ask me this all the time. So if you have to do it again, what would you have done differently in your path, right? And then the way I look at this is, I would enjoy the failures more. Instead of getting depressed, instead of feeling the insecurity, the guilt, and let's enjoy this, because failure is actually what makes us great. Failure is actually what makes us successful down the road, because we are learning from it, and then we can rise above it and then push through it. And looking back, I'm thankful for the things I experienced, years ago for the situation I was in
Mhm.
years ago. So being able to recognize, hey, it's okay. That's part of life. Let's get through this, and we'll be bigger and stronger. I think that's the something I may not have known in my younger days, but now looking back, I think those are very valuable lessons.
For sure. And when you're in the middle of it, sometimes it's hard to know that. But that's when I'm going through a tough period. I'm like, 5 years from now, this is gonna
Mhm.
seem like a small little blip. So let's just, kind of keep focused, moving forward and improving. So, and this kind of is a good segue into our next question: is what's one of the biggest challenges you've had to overcome in your career path?
Yeah, so there are many, right? I think we can't get to where we are today without the challenges. I mean, just an example. So my very first year in practice was during COVID,
Oh,
and that's an interesting time, right? Because I was excited. I finished training. Finally, I get to treat patients. I get to do what I love to do, and then suddenly the world shut down. And I was pregnant with my daughter at that time. So there was many different things. There was a financial struggle, there's a practice struggle, and there's a personal things I was dealing with. And how do we rise through that and then know that, you know what, this is temporary. It's not going to be like this forever. If we just keep pushing through and keep treating patients the way we are, finance will take care of itself.
mhm.
Practice will take care of itself, and then the world will take care of itself. But that's just a minor example of, how the real world after training isn't always better and greater than the residency and fellowship. So, but looking back, I think we all have struggles in different ways. But what do we do with it, and how do we move forward? Is the most valuable lesson. And then the other struggle, and I still struggle with this from day to day, is back to what we talked about earlier, is patient education. Because there are still many patients coming to my office, and all they want is that quick fix for a few hours, right? That one
Feels
pill
really
of
easy,
pain
right?
medication. It's so easy just to give it to you, make you happy, and you're happy, I'm happy. You can walk out the door, and that pill can give you 3 hours of pain relief. But the tough conversation is, I'm trying to get to better long term, not for 3 hours. And what can we do about it? Some patients are receptive to what I say. Some people, they're not, right? And sometimes they walk away not very happy with my care, even though I feel like I'm doing my best to be the best physician for you and to help you the most. But how do you juggle that interpersonal relationship with that patient who might be pretty upset because I'm not giving them that one pain pill that they were looking for? And the struggle doesn't end. But each of these things, I try to modify the way I talk about it and how to improve this conversation. So I'm still trying. It's not
Always learning,
easy.
right?
Always learning and keep
For
pushing
sure.
forward.
Well, congratulations. Sounds like things are going really well in your practice, and so you have more and more success. You've got to apply that time. Have you ever considered, or do you look into any alternative investments where you can create other income outside of what you're doing? Like at me when I was doing PT, I had to work the hours to make the PT. So that's when I started looking more at commercial real estate. Have you ever looked at any alternative or passive investing opportunities?
So I'm going to shift this in a different lens. Let's shift thinking investment more than just financial investment. So if for me, I actually really focus on investing in the three P's in my life, which is people, process, and purpose.
Yeah.
Right. So if we can align our time and energy with the right people around us, with the right mission, and sometimes opportunity will just follow. And then the financial side will take care of itself on its own. So I've been trying to use that as the principle that guided me in my life. And, what can I do to invest my time and energy into the right people, the right project, the right mission, the right goal, and help elevate the people around me. And then suddenly what surprises me is that, wow, financially, I'm taking care of myself as well in a way that
Yeah.
some often is unexpected.
That's what an awesome perspective, and you really, really appreciate that. So good stuff. So as for wrapping up the interview, do you have any exciting plans or initiatives in the next 6 to 12 months?
Yeah. So first of all, locally, I have an incredible, amazing team. I have two advanced nurse practitioners and have staff industry partners, and really they help me, allowed us to take care of patients in a more consistent way and deliver that high quality care. But the biggest part of my work isn't necessarily what I can do for one patient in one exam room for that one procedure. I'm trying to think about the system, right? So, and if I think about how we can scale the impact, it's not necessarily how care is delivered at that moment for that one patient, is how this care can be delivered elsewhere to hundreds of thousands of patients across the country and globe. So I enjoy teaching, and I travel a lot. I do research. I have given about 100 talks across different parts of the country and different parts of the world, because my passion isn't just what I can do right here, right now, is what can we do across different states and countries. So tens of thousands of patients can benefit from the development, from the innovation, from the care that I develop. And then the other part of it is, we know technology is being seen very quickly, and I would love to be this bridge between medicine and innovation, so medicine and industry, and how can we translate these technology to better serve our patient from day to day.
That's awesome. And, a couple of things you said was the reaching people not only locally, but other states, other countries. And I don't know, the licensing, with the internet, that you can do Zoom treatments, or which, you may have to be licensed in another state to see somebody, but at least teaching other physicians in that area some of the things you're learning so they can go in and implement it. Or even maybe somebody in a third world country that you may not be able to travel there, but if you can help it, somehow, obviously within the licensing of your practice, do that. How many more people can you reach that way that don't have to walk into your clinic to be treated and be helped by you? So that's very exciting stuff.
Yeah. Thank you. Thank you.
Thank you so much, Melissa, for joining me today and sharing lots of great tips and insights. If people would like to connect with you and find out more about you, what's the best way for them to do that?
Yeah, thank you. I'm very active on LinkedIn, so you can find me there, Melissa Murphy, MD, MPH. I'm based in Dallas-Fort Worth, Texas. So Nick, thank you so much for having me today. Your podcast series has changed, I'm sure has changed many lives and encouraged many of us to move forward day to day. So I thank you for doing what you do for us.
Thank you so much. And thanks everyone for listening. Be sure to like and share and keep tuning in. Thank you. Thanks, Melissa.
Thank you.
Thanks for listening to the Flex Forward podcast. If you've got grit, growth, and a great story, visit flexforwardpodcast.com/guest to apply and join us on the show.